Pennsylvania. Gail Wilensky of Project Hope says the cost could approach $1.5 trillion. It's a sobering figure. Gail is a former administrator at the Centers for Medicare and Medicaid. She joins us now from our Washington newsroom to talk about the challenges ahead for health care reform. Gail, thanks for being with us. My first question to you really comes off of the back of that conversation we just had with Hans. In order to make this happen, are we really just going to have to accept the idea that there are going to be major compromises to these competing pieces of legislation?
There will be major compromises to the competing legislation. There are different views about how to fix the problems, how to expand coverage, how to slow down spending, how to improve the value for the money we spend. It will take some compromises. I hope it'll be bipartisan compromises as well.
But effectively, does that just amount to a massive disappointment? The Clinton administration tried to get health care reform rolling in the early 1990s. That ran aground and nothing really happened. Now we have a president with an ambitious agenda, but he's facing opposition from his own party in Congress. When are we really going to get health care fixed, and what is it going to take?
The president had a problem in that he had some other important legislation, mainly the stimulus package, that he had to get through first. That is unfunded spending. It raised the bar as far as some of the Democrats were concerned in no more spending that's unfunded. That means health care reform can happen, but last week you saw sticker shock when people began to realize just how expensive it would be, coupled with Democrats as well as Republicans saying we need to pay for it. Now the question is, how much can you really do? Where are you going to get the money to pay for this expansion?
Precisely. Gail, you're intimately familiar with the way federal money gets doled out to these programs. Is there one area, do you feel, we're not focusing on enough?
Well, we're not really focusing right now on how to improve the value for what we spend and how to slow down spending. Most of the conversation is how to expand coverage. That's of concern, of course, to the people who don't have insurance coverage. Politically, it's always important. We've got to really figure out not only how to finance those expansions. We have unsustainable health care spending. Medicare has made promises it doesn't have the money to pay for. That is troublesome going forward. We need to make sure that a new program is not only paid for initially, but it's sustainable. That is, we're not promising benefits that we won't be able to pay out into the future. We haven't really focused enough on how to slow spending.
Gail, with 45 seconds left, is waste perhaps a bigger issue than people are acknowledging right now?
Well, not getting very much value is a big issue. The problem is, how do we reorganize health care to get rid of that and still keep the quality and innovation we want? It's tough. We're beginning to talk about it, but we need to be very specific how to make those changes happen.
But are we being honest enough with ourselves? Because people have pointed out other countries do continue to innovate with a system that doesn't waste as much as the American one.
Well, it's tough. We're used to having health care in a very open environment, being able to go to the specialist we want, having access to technology whenever we want. That's a very different environment than health care in terms of other parts of the Western world. We can do a lot of things differently. It's a question of what we want to, as people, do differently. One of the things is, of course, make sure everyone has coverage.
All right.
But the other is get better value.
Gail, thank you so much. Gail Wilensky of Project Hope.